The message from Western Cape officials, that's the Premier as well as the MEC for Health, is definitely one of not to panic, and also saying that the province is indeed ready to deal with any cases of the COVID-19 coronavirus. This, of course, comes on the day that it had been confirmed that one person in the Western Cape has tested positive for COVID-19. Of over 87 tests having been proven negative in the province, this one case has now tested positive. Joining me is MEC for Health in the province, Noma French Mbombo. Dr. Mbombo, very briefly, what can you tell us about this 36-year-old patient that has tested positive for COVID-19?
The patient is a traveler, has traveled in other countries before and then presented on the 9th of March when he arrived, went to the private hospital and then was tested there as positive. Currently, he's in self-isolation, as has been the discussion between the patient and the clinician, because apparently he's not necessarily in a high risk. For now, for us as a province, our responsibility is to contact, to trace the contacts, which is the team has already been activated. We'll know then how many contacts that the person has been within in our space. But remember, as I indicated, that he will have traveled in many other airlines, which is, I'm sure, the National Department of Health, the DECO, as well, will be dealing with that part of it.
Minister, today we've done a tour here at the facility at Targbeck Hospital. It's one of the designated hospitals for isolation of possible COVID cases. You have also said that currently 3 patients are being treated here in isolation. Tell us why, and also if you can give us just a picture of the measures in place, the protocols in place for dealing with possibly more cases.
Okay, just for correction, they are not here for treatment, but they are here as part of the quarantine processes, especially when those patients are presenting with the symptoms and also they're waiting for the results. So that is important. And our systems are already activated. As you have been going up there, you saw the staff, although they are in joyful mood, but they are ready. Especially the personal protective clothing equipment, where you have shown in terms of what type of mask that they are wearing, and also in terms of what type of the clothing that they have to wear. But again, remember, most of these patients, when they come, it's either they've been coming from through the port, which is the airport, and they're not necessarily the sick patients. Some of them that they will have been exposed, but now they just want that kind of a confirmation. But what we are saying to the public, that they don't have to come and block the Targbeck hospitals. Anyone can go to any facility for the testing, but only if you have got a history of international travel or you have been exposed to the person who has also traveled internationally. But the first part of it, call this number. But again, you can go to even to a private hospital or private clinic where they could be able to take the swabs. But again, back to basics. Protect yourself through the basic hygiene, thorough washing of the hands, and also trying to avoid to touch your faces. Because remember, the virus currently is not necessarily airborne, just like TB, but it's mostly through the droplets. So when the person infected sneezes or coughs, and then that's when probably the droplet can land into your face or to whatever, to your hands or into a surface, they will touch the surface. So that is important.
Thank you so much for your time, Dr. French Mbombo, of course, the Western Cape MEC for Health, talking to us here at the Targbeck Hospital, one of the sites identified for dealing with, treating and also isolation of patients presenting positive with COVID-19. At this point, just one positive test for the Western Cape, a 36-year-old male. We understand that he had then presented himself to a private facility, is now in self-isolation. And of course, the main message from all authorities here in the Western Cape is to adhere to hygienic practices, to wash hands for at least 20 seconds with soap and water, alternatively to use hand sanitizer. And then also the core message is not to panic, the province saying that they are following all protocols to make sure that the number of positive cases are limited here in the Western Cape.